Once in a while, we come across news articles claiming a person who was proclaimed dead by the doctor came back to life miraculously on the way to cremation or on the way to burial. Even in olden days, we used to have safety coffins which used to be fit with a safety mechanism to avoid premature burial. In case there was a premature burial, it used to send out an alarm. My point is, death always has been an enigma. It was always difficult to understand death, and this is what we are going to do in this session on thanatology. We are going to study death in all its aspects. Thanatology, the word per se, is derived from Thanatos, meaning the god of death, and logos, meaning science. So thanatology is that branch of science that deals with studying death in all its aspects. The word death is not defined in IPC. It just says death denotes the death of the human being as per section 46 IPC. But in Registration of Births and Deaths Act, the section 2B claims permanent disappearance of all evidence of life at any time after live birth has taken place. When there is no signs of life after live birth has taken place, it is said to be death as per Registration of Births and Deaths Act, section 2B. So every dead body goes through two different stages of death. So when I say types of death, it doesn't mean different bodies go through different types of death. These are two stages of death. One is your somatic death, which means the systemic death or clinical death when the death is declared. The other one is the molecular death, where the individual cells die. This is a progressive disintegration of the body tissues. Somatic death is a complete and irreversible stoppage of circulation, respiration, and brain functions. So when these three stop, which we call as the Bishop's triad of life, when one of these three stop, it is called as somatic death or clinical death. So as long as the circulation of the oxygenated blood is maintained to this part of the brain, that is the brain stem, life exists. So whether the person is alive or dead can only be tested now by withdrawal of artificial respiration or any artificial maintenance of life. A person who cannot survive upon withdrawal of this is said to be dead. We need to keep in mind, when I talk about moment of death, death is a process, it is not an event. Except in certain cases like crushing of brain, bomb blast or vasovagal shock, where death is instantaneous. In all other cases, death takes place over a period of time and not at one particular point of time. And historically, death was about stoppage of heart and lung functions. But with the advent of heart-lung machine, with the advent of respirator, the definition has changed. Now, the concept has come to brain death, specifically brain stem death. So what is brain death? There are three types: the cortical or cerebral death, the brain stem death, and the whole brain death. Cortical or cerebral death is when the brain stem is intact. Here you see a vegetative state in which respiration will continue, but there is total loss of power of perception by any of the senses. But in brain stem death, the cerebrum is intact, but it is cut off functionally because of the stem lesion. Here there is irreversible coma with loss of respiration, what we call as living cadavers. The third type is whole brain death, where we see both a cortical lesion as well as a brainstem lesion. The definition of brain death was given by Harvard Medical School in 1968, and they recommended three criteria for determining permanent non-function of brain. One is unreceptivity and unresponsivity. Number two, no movements or breathing. Number three, absence of any reflexes, that is areflexia. They added a confirmatory test as a flat isoelectric ECG, and this came to be known as Harvard's criteria. So for diagnosing brainstem death, there are certain preconditions and prerequisites. What are the preconditions? It must be established that the cause of coma is irreversible. A structural brain damage that is irreversible should be the cause of coma. And certain things need to be ruled out, that is drug intoxication, hypothermia, and any profound metabolic disturbance needs to be ruled out prior to it. So who will do this? at least 4 people are needed. One doctor who is the treating doctor, other one a neurosurgeon or a neurologist, the third one the in charge of that hospital, and fourth one a independent doctor. So that means at any cost the transplant surgeon cannot be a part of this team of doctors. So what are the brainstem reflexes that we are looking at? We need to look at the pupillary response to light, the corneal reflex, the vestibulo-ocular reflex, and absence of grimacing in response to painful stimuli, and absence of gag reflex. What is pupillary response to light? When you shine light onto a person's pupil, there is reflex constriction, that is pupillary response to light. Corneal reflex, when you take a wisp of cotton and touch someone's eye, or you attempt to touch someone's eye, there is reflex closing of the eye. Vestibulo-ocular reflex, when you irrigate the ear with cold water and it touches the tympanic membrane, what happens is the eye moves to the same side. And there is grimacing in response to painful stimuli in normal people, which is absent in case of brainstem death. And there is also absence of gag reflex, that is when you take a swab and try to touch someone's throat with the swab, someone's pharynx with the swab, there is gagging action reflexly, that is absent. What are the nerves responsible for this? For the pupillary action, there is the second and the third nerve. The corneal reflex is through the fifth and the seventh nerve. The vestibulo-ocular reflex is through the eighth nerve, and the efferent are third and the sixth nerve. For the grimace reflex, the sensation is carried by the fifth nerve and the response is carried by the seventh nerve. And in case of gag or cough reflex, the afferent is ninth nerve and the efferent is 10th nerve. Now, coming to molecular death. Molecular death is when the individual cells begin to die. That is, death is occurring piecemeal here. So, the death of cells and tissues individually, which takes place usually 1 to 2 hours after the stoppage of all vital functions, is called as molecular death. And this is something that occurs piecemeal, and individual cells will live on the residual oxygen that is there for variable time. Depending on the type of tissue, the cells live for variable time. Okay. So now we have seen how the body goes through 2 stages after death. One is the body dying as a whole, which is called as the clinical death or the somatic death, and then the individual cells die, which is called as the molecular death. Now let's look at modes of death. What is a mode of death? It is the abnormal physiological state which pertain at the time of death. It could be coma, syncope, or asphyxia. So we need to remember these are not causes of death, these are mere symptoms, and that is because of the abnormal physiological state at the time of death. The cause of death is the disease or injury responsible for starting the sequence of events which produced death. So there is a sequence of events which leads to death. What caused that or what started that, that is the cause of death. Okay. So in case of gunshot wound to the abdomen, the cause of death here is the gunshot wound. Okay. He might have died because of syncope as a mode of death, but the cause of death here is the gunshot wound. Similarly, stab wound to the chest is the cause of death. Adenocarcinoma of the lung is another example for cause of death. And coronary atherosclerosis is another example for cause of death. Now, what is the manner of death? Manner of death is the way in which the cause of death was produced. So, it could be either natural one or unnatural one. Natural manner of death is when the death is exclusively from a disease, and unnatural one is when it is either exclusively by injury or death is hastened due to injury in a person who is already suffering from a disease. So as I said, a manner of death could be natural, unnatural, or something we do not know, obscure. And unnatural can be further divided as homicidal, suicidal, accidental, or undetermined manner of death. Now, having seen the manner and mode of death, let's see what is the mechanism of death. It is the physiological or biochemical disturbance produced by the cause of death which is incompatible with life. For example, in case of RTA, where there has been loss of blood, the mechanism of death may be shock, or in case of burns, it could be sepsis or toxemia. In case of electrocution, a person could die of ventricular fibrillation or he could die of respiratory paralysis. So these are mechanisms of death. With that, let's move to a new concept, sudden natural death. What is sudden natural death? As per WHO, in the latest version of ICD, that is International Classification of Diseases, death which is non-violent and not otherwise explained, occurring less than 24 hours from the onset of symptoms. So any apparently healthy individual dying within 24 hours of onset of any symptom where death doesn't seem to be because of a violent cause. So the emphasis here is on unexpected character of the death rather than the suddenness of the death. So almost 10% of all deaths are because of sudden natural death. Now, let's look at what are the causes of sudden natural death. There are serious causes, which is around 44 to 55%, like cardiac tamponade, ischemic heart disease, any congenital heart disease, valvular heart disease, hypertensive heart disease, etc. And then you have respiratory causes, which is around 18 to 23% of sudden deaths. It could be any pulmonary embolism, bronchopneumonia, air embolism, etc. And then you have CNS causes, which is around 10 to 15%. And the causes could be meningitis or any subarachnoid hemorrhage, intracranial hemorrhage, etc. And then you have alimentary system causes, which contributes to around 6 to 8%. The causes could be hemorrhage from a peptic ulcer, ruptured liver abscess, ruptured esophageal varices, or it could be even hemorrhagic pancreatitis. Then you have the genitourinary system, which contributes to around 3 to 5% of all deaths of sudden death. The causes could be chronic nephritis or renal TB, etc. And then you have miscellaneous causes, which could include your Addison's disease, hyperthyroidism, diabetes mellitus, infections like malaria or even anemia. All these are some miscellaneous causes which can cause sudden natural death. So what is the medico-legal significance of this? Naturally, when a person dies unexpectedly within 24 hours of onset of symptoms, it is going to raise a lot of suspicion regarding the manner of death. There is going to be suspicion that there has been some sort of foul play. So these kind of cases will be autopsied to understand the cause of death better. Suspended animation. Now this is a very interesting concept which has been used by a lot of sci-fi movies and sci-fi novels, especially the ones that include intergalactic traveling, because suspended animation is a way of keeping humans alive for hundreds of years. So what happens here is, it is a state where the heartbeat and respiration of a person is so low that a person appears dead. His vitals are at such low that it cannot be picked by your routine clinical examination. So that is what is called a suspended animation. Now this could be either produced voluntarily, as in case of certain yogis who can do that, or it could be involuntary, and this is known to be seen in cases of barbiturate poisoning or opiates, seen in cases of certain newborns, and even in drowning or electrocution, etc. So these are certain cases where it is produced involuntarily. There has been an attempt to produce suspended animation artificially, and so far we have not achieved much success with artificial suspended animation. So what is the medico-legal importance of this? Again, a person who is in suspended animation may be declared dead prematurely. So premature declaration of death is the medico-legal importance of suspended animation. Coming to the another concept called as presumption of death. So, as per section 107 of Indian Evidence Act, the burden of proving death of a person who is known to be alive within 30 years is on the person who claims him to be dead. So, the law presumes a person to be alive unless the contrary is proved by someone who claims him to be dead. The section 108 of IEA, that is Indian Evidence Act, states the burden of proving that person is alive who has not been heard of for 7 years is on the person who claims him to be alive. For example, a person goes missing because of a missing flight, say a flight that is traveling over the Indian Ocean crashes into the Indian Ocean, no debris is found, no dead body is found, and such person is not heard for the last 7 years. After 7 years, he is presumed to be dead. That is presumption of death. So the law presumes under certain conditions that a person in question is dead if it is proved that the said person has not been heard of for the past 7 years by those people from whom he might contact, or those people who expect him to contact them. So what is this presumption of survivorship? So this question arises in question with inheritance or distribution of property. For example, when two or more people who are the natural heirs of each other, they die in the same mishap. Okay, they lose their lives in a common disaster, say motor accident or earthquake, etc. So in these kind of cases, the presumption of survivorship comes into question. So what happens here? The law presumes that the younger amongst the two might have survived the longer duration. This is, however, not true in India. The law of India does not recognize any such presumption. What does it do? It establishes the survivorship after examining the available facts and evidence. It does not just presume like in other countries. So, with this, let's summarize this session. In this session, we have seen death and its types, that is the somatic death and molecular death. We have seen brain death. We have understood the concept of brain death. We have understood what is the mode, the manner, the mechanism, and what is the cause of death. We have seen the sudden natural death. We have seen the definition. We have seen various causes for sudden natural death. And we have seen what is suspended animation.